Welcome to the discussion. Today we're diving into the fascinating world of pre-hospital emergency medicine and a technology that's rapidly changing the landscape. Point-of-care ultrasound, or POCUS.
The integration of POCUS into pre-hospital care is truly transformative. It allows paramedics to make faster, more informed decisions at the scene, potentially saving lives.
It sounds revolutionary, but what are some of the key benefits we're seeing?
Well, in cardiac arrest, for example, POCUS can assess cardiac activity without interrupting CPR, guiding resuscitation efforts. It can also rapidly diagnose conditions like pneumothorax or pericardial tamponade, which require immediate intervention.
So quicker diagnoses lead to faster treatment and better outcomes. But it's not all smooth sailing, is it? Let's talk about the advantages of using POCUS in pre-hospital settings. You mentioned faster diagnoses and improved patient outcomes. Can you elaborate on that?
Absolutely. The immediate feedback from POCUS allows EMS provider to make informed decisions quickly. In situations like trauma or cardiac arrest, this speed is crucial. For instance, identifying a pneumothorax early allows for immediate needle decompression, potentially preventing a life-threatening situation.
While the benefits are clear, implementing POCUS faces significant hurdles. What are some of the major challenges?
Cost is a significant barrier. High-quality ultrasound devices are expensive to purchase and maintain. Then there's the training aspect. Paramedics need specialized training to use these devices effectively, which requires substantial time and resources. And finally, there's a lack of robust evidence directly linking pre-hospital POCUS use to improved patient outcomes, making it difficult to justify the investment.
The training aspect is critical. What kind of training are we talking about, and what are the challenges in providing it?
Comprehensive training is essential, encompassing both theoretical knowledge and expensive hands-on practice. Ensuring a baseline standard of practice across all personnel is crucial, but limited accreditation opportunities can hinder this. We need structured programs led by experienced professionals to build confidence and competence.
The cost of equipment is a major factor. Are there any cost-effective solutions emerging?
While high-quality devices are expensive, more portable and user-friendly options are becoming available, such as the Butterfly IQ. However, cost-effectiveness analogies are crucial to justify these investments and ensure they fit within existing budgets. Maintenance is also a factor. These devices require regular servicing to maintain accuracy and reliability.
The lack of standardized guidelines is another challenge. How can we address this?
The absence of national guidelines or governance structures creates uncertainty regarding legal liabilities and standards of care. Clear protocols are needed, and advocacy for national guidelines or local policies can provide a framework for standardization and credentialing.
Using POCUS into the dynamic pre-hospital environment presents unique operational challenges. What are some of those?
Performing ultrasound in moving ambulances or cramped spaces can be difficult. There's also a risk of delaying critical interventions if ultrasound procedures prolong scene times without providing immediately actionable information. Balancing POCUS use with the urgency of other interventions is key.
The lack of a strong evidence base is a concern. How can we address this?
More research is needed to directly link pre-hospital POCUS use with improved patient outcomes. This will help justify its implementation. Furthermore, effective communication between EMS teams and hospital departments is crucial to address any skepticism about the reliability of POCUS findings.
What strategies can we employ to overcome resistance to POCUS adoption?
Comprehensive training, highlighting evidence-based outcomes and case studies, utilizing user-friendly devices, conducting cost-benefit analyses, and fostering interdisciplinary collaboration are all crucial. Advocating for policy support is also essential.
What other factors should be considered for successful implementation?
Securing early leadership support, developing clear protocols for POCUS use, and monitoring progress through continuous quality improvement initiatives are vital for effective and sustainable integration.
So, in conclusion, while challenges exist, the potential benefits of POCUS in pre-hospital care are undeniable. What are your final thoughts on the future of POCUS in EMS?
I believe that with focused efforts on training, addressing cost concerns, developing robust evidence, and establishing clear guidelines, POCUS will become an indispensable tool in pre-hospital emergency medicine, significantly improving patient care and outcomes. The future is bright for POCUS in EMS.
That was a great discussion. Thank you for sharing your expertise.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.